Okay, okay. So the last time we looked at the concept called ecosystem. We looked at the kinds or types of ecosystem and how anthropogenic activities can affect our ecosystem. Today we are going to look at health and development. And there are two very important concepts. And I think they are concepts that everybody should take interest in. So first, we'll look at the link between health and development, and then we'll proceed to see the direction. So is it that development leads to better health, or it is better health that leads to development? So moving on, there are two examples which I wish someone will read to our hearing. Or anybody who has taken good breakfast, go ahead and read.
Madam Esther. Okay.
Yes, Madam Esther.
Read for us.
Yes. So
read.
please, yes, please.
Okay. I don't have my eyes, but I can read. Introduction. The link between health and development is two-directional. For example, health can affect income through their impact on labor productivity, savings, rates, investments in physical and human capital and age structure. In the other direction, income can affect health by, for example, improving the ability to obtain food, sanitation, housing, and education, and providing incentives to limit family size.
Exactly. Yes.
Application of. Should I continue?
You hold on. So let me explain that first.
All right.
So health, well, it is in plain English. Health can affect our income levels. Okay, so someone will ask how. Okay, assuming an impact on labor productivity. So, for instance, some time ago, Obuase mines was struggling, all because most of its workers were taking leave permits or sick leaves, a lot of sick leaves. And by that, they were struggling to maintain operations. So what they realized was most of them were taking sick leaves because of malaria. So they had to do mass spraying throughout Obuasi. And by that, the general residents, or by destroying the ecosystem or the very risk factors in the system that cause malaria. So they sprayed the mosquitoes away. They looked out for where they breed and all that. They sprayed all those things. So by that, malaria cases reduced, particularly among the mine workers. So by that, they were able to, have less people coming for sick leaves. So what it means is that once you are healthy, you can work for long hours. And by that, it increases productivity. And if you are healthy too, you appreciate that you spend less on hospitals or going to seek for health care. So let's say Kofi earns 500 cedis. He falls sick, and by the nature of the condition, he has to spend about 250 cedis on his condition. So which means that he has only 250 cedis left to sustain him for the rest of the month. And by that too, once you are not well, taking a chronic condition like stroke, which can be very expensive to manage, you realize that you have little to save. And in the same light, you realize that there will be less human capital. People who work to generate wealth wouldn't be available because they are all sick. And it is also argued that health also affects its structure, in the sense that when people are highly fertile, they can give birth to a lot of children. So one thing we are anticipating is we are expecting baby boom after this COVID issue, where a lot of people have been locked down. So of course, that will happen in a fertile population. So if you have a lot of people who are not fertile, you don't expect a baby boom. But once the Ghanaian population is youthful and their majority is in the reproduction age gap, then you should expect baby booming and all that. So largely our health affects our income or our work. And in the other round, this argument is just like the chicken and egg argument, where people want to find out if the egg came before the chicken or the hen came. But some people are saying that, well, if you are healthy, then you'll be able to develop yourself. Another school of thought is also saying that, well, if you are developed, then you'll be healthy. So those who are saying that if you develop, you are healthy, they are saying that, well, if you have high income, then you'll be healthy because you'll be able to afford your food, you'll be able to, your environment will be improved, you sleep in better places that are less, you'll be able to stay in better neighborhood. Oh, okay, thank you. You'll be able to live in better neighborhoods and you'll be able to afford good education that would influence your decisions to engage in healthy lifestyles. And also there will be incentives for you to, of course, if you have money, hello.
Yes, we can hear you, sir.
Yes, so once you can afford, you can be able to see the doctor to teach you how or the measures you should take to control your family size. So it is a hen and egg argument. So whether the egg came first or the hen came first. So I want to put it to you, in your view, what do you think, or which of the two items do you think came first? Is it health or development? Is it development that leads to better health, or it is better health that leads to development? I put it to you. You see at the course room.
Hello, sir.
Yes, I can hear you loud and clear.
Hello. Yeah. If you are not in the good health, you cannot do anything to develop yourself. Even if you have millions of cedis and you are not strong enough, you cannot use that money to do any development.
Yeah.
So development is health is paramount over development. You can have all the money you have, but you cannot use any.
But if you have all the health and you don't have food, where will you get the energy?
Me,
yes.
I think health is.
As they say, money does everything. If you have money, you can have everything. If you have money, you have good health. So I think development comes first. If the money is there, A Nigerian man will tell you money stop nonsense.
Exactly. Money stops nonsense. So when the money
So
is
we
there,
are
you can.
Money talks and bullshit works.
If you have the money, people can work for you. People can develop for you. So I think, in my opinion, I think
No,
development.
what if
Money
those
can,
what if those people don't have
at your network, I can't. We can hear
help?
you.
Those people also need help to be able to do what you want them to do for you.
Your network is bad,
So
so
they can use your money to do something for you.
Okay. Okay. So, Madam Esther, please continue with the second point. Or who else is there to read the second point, for example?
Okay. Application of advanced technology in agriculture have enabled an increase in food production, which in turn increased human production capacity, has also resulted in decreased childhood malnutrition and subsequently lower prevalence of chronic illnesses and improvement in public health. Improved health will lead to improved labor productivity and drive other.
Yes. So once again, there's another example in favor of development first, health first, where it so argues that, like she read, that once there's, as we improve our technologies, agriculture and all areas, we will have the energy to improve in other areas. And if we look carefully, you realize that we have been able to minimize the effects of a lot of conditions through developments like the 6 killer diseases. Now we have the vaccines and other things that, and largely because of what we eat, the kinds of things we eat, because and a lot of the conditions that people suffer, you realize is because of the kinds of their lifestyle and the kinds of the things they eat. So once all those things are put in check, then meaning that if you are going to eat, you don't just eat anything. There are things that you have to once you engage in those things, your chances for experiencing certain conditions, particularly the chronic ones, are lowered and public health is improved, all because of those interventions in the name of development. Yes, and once our health is improved, we'll be able to do more. Yes.
You can't hear you. It's like your voice is echoey.
Okay. Is it better? Okay,
I think
second. A second. Let me move. A second. Hello.
Yes,
yes.
sir.
Oh, come on. Hello. Hello.
Yes, sir. I can hear you.
Yes, sir.
Is the echo gone or is still?
It's better now.
It's okay here.
It's not okay.
It's okay.
It's okay. It's okay.
Okay, sure. Yes. So, I believe we know what health is, right? I believe we all know what health is. If you don't
Yeah.
know, I'll
Yes, yes, sir. Yes, sir.
send you to level 100, first semester.
Yes,
No,
sir.
there's no need to spend time trying to define health.
Oh no, because I'm sure Evans has forgotten.
I mean,
Even
it won't come in exams. So it won't come in exams. So
hey,
I mean,
please,
what hair do you have that you are using an Afro comb?
see, when you are learning, you just put the thought of exams away. Just learn for learning.
This class here is
yes, sir,
joking.
sir.
Bradford, you joke, they fail you. You joke, they fail you.
Sir, they have made it in such a way that like we
Yeah.
have this thought that it's all about exams.
Oh no. No.
Yes, so it's true. Radford is like
Yeah.
everything the teaching, the learning and everything is linked to exams.
Exams. Oh
So we
no.
always even in the
It's
way
not
the
only
way.
in Radford, though. Evans, I don't mean to cut you. It's not only in Radford. Maybe
Please,
it's like
I'm in Radford, so I'm talking connecting to where I am
sure.
now.
Even if you
Yeah.
know and then you don't pass the exams, they consider you not to be good.
Mm.
So let's continue.
So,
Hmm.
yes. Well, so exams is just 2% of your life. So don't. Okay. So health is a state that allows the individual to adequately cope with all demands of daily life. Yes, of course. So if you are not healthy, you cannot be able to engage in, or you will not be able to carry out the activities of life in under most circumstances. And of course, it also depends on your level of health, because there are some conditions that will allow you to do certain things, and there's some conditions that even require that you don't even move around, just be there. Sometimes people have to turn you around in bed and all that. Yeah, so it's very important, very important. So of course, we know the determinants of health, right?
Yes.
Yes. So, and there are different ways of classifying the determinants of health. Some people, like we are seeing here, are saying biomedical, genetic, psychological. The biomedical and whatever biological, genetic. They are one, like in a common group. They have psychological and the health behaviors and culture. They're also in another group. And we also have the environmental factors that have not been captured here. Yes, so, and individual factors, depending on how you want to look at things. And these are the determinants of health. So it means that if you want to measure health, these are the areas you should look at. So some people, you can only tell their condition by analyzing their health. A typical one is the sickle cell, and a lot of the factors, even cancer. Your genetics can be a risk factor if you have history of cancer and all that, and you engage in activities that trigger cancer. It means your chances of getting or being diagnosed of cancer is very high. And there there are indicators that are used to measure health, like life expectancy. So the life expectancy indicator is basically how long you are expected to live. So it's just the average number of years. So in Ghana, they calculate the average number of years people live in Ghana. Then that becomes the life expectancy. So in Ghana, what is the current life expectancy rate? Or what is life expectancy in Ghana?
Hmm.
65.
Okay. Is what?
65.
So in Ghana, how long are you expected to live?
65.
said 35.
She said
Are you saying
65.
35? Oh, okay, 65. Wow. Hey, then we have advanced. At a point it was 57 and it went to 63, so it's not 65. Okay, wow. My brain, what's it? Yes. So, so it doesn't mean that we are all going to die at 65, but it's just the average. So, about 2 years ago, I had the opportunity to support a friend during their grandmother's funeral. So, and the grandmother was about, I think she was around 83 years. She comes from the Kwehu area. So I was struck because, that was the first time I think I went to the funeral. I attended the funeral of, maybe I'm not the type who goes to funerals, but I think that was the oldest person's funeral I ever attended. So I decided to just go around to have a fair idea of the age at which they die. So, and I checked posters and I was seeing 100 and something. And so it even means that even the 83 crowd was on the lower side. Dying at 83 was, she was one of the youngest people to have died. Looking at the posters I saw, the mountainous area, the Kwehu, Betifi areas, and
do you know something?
No.
Those days, the kind of life they lived in those days is better off compared to now. The kind of food, the lifestyle, and the body not does when the kind of food we even eat, a whole lot of chemicals and so
Exactly.
yeah, that's the reason why they lived a better life.
Yes. So then it's dawned on me because those areas there are less cars over there. Although they are rich, you see fewer cars there, and you realize that it's mountainous area. And as they climb the mount, like they climb, it's up and down, So by that, the exercise, physical exercise, some of them go to the farms, and you realize that there's less of air pollution in those areas. And I realized that it was until recently that which may be accountable for by this Kwehu noise they've been making about how do you call it? That festival. Exactly. Yes. So you realize that as people travel to those mountainous areas, they travel with a lot of things, including insects, mosquitoes. Mosquitoes hides in their luggages in their cars. So as they go there and then they open their cars, the mosquitoes also fly to go and paraglide around. And when they are coming back down, they don't come back with their mosquitoes. They just leave the mosquitoes and insects there, and they also breed. So, and with global warming, is also making it more conducive for malaria and mosquitoes to breed in those areas. Those areas are becoming warmer, making it more conducive. But in general, you see their lifestyle and look at the conditions under which they live and realize that they are, and yes, there's less, like I mentioned, air pollution. So you realize that they are living much more healthier lives than us, and they don't go to the KFCs, those KFCs and those canned foods. Yes, they hardly eat outside. They eat from the house what they prepare, things that they have control on. So they can control their salt intake. They eat less of those spices and things. So they are living long. And I'm sure I won't be surprised they don't have a lot of pressures on them. The kind of things that kill us here do not kill them, because a lot of the homes have rooms that they even need people to stay in that. But down here, even getting rent is an issue. In itself, it's a psychological stress. You have to pay 2 years advance. So as a young person, sometimes to finding love, it's also another psychological issue. You finish school and the young ladies are telling you don't have money, and you're also thinking about
and all that.
Yes, so they are all killing us quickly. So that same day, I had the opportunity to go to the Pong areas and looking at their posters, I was seeing 55, 45, 60. I was like, this is Ghana. How come some people are living a minimum of, let's say, 80 years and another people are living a maximum of 65, 60, 70 years? It doesn't make sense. So meaning that your geographical area where you live can also influence your health. And in that sense, you realize that when you add all of them and then you work out the average, you'll be getting something like a 65 that Madam just mentioned. So that is what we refer to as the life expectancy. And we have another measure of health called mortality or death when someone dies. So the number of people dying. So if you add rate, so we have mortality, and we have types or forms of mortality. It can be all-cause mortality, where you are saying that, okay, we are looking at, okay, over a period of time, the number of people who died, mortality rates from all causes, and you can also look at it as cause-specific. So is it mortality due to communicable disease only or non-communicable diseases over a period? And we also have morbidity. Yes, so the condition is morbidity. And we have the disability adjusted life year, which is the DALY. So the DALY is just a manipulation or calculation of your expected. So you are born today and you fall sick. So they look at the number of years you're expected to live, and they calculate the number of years that another form of DALY is also the one called the years of life lost, where someone dies and the person's age at which the age at which the person died is subtracted or deducted from how the life expected years, or how long the person was expected to live. So let's say Kofi died at the age of 43. One more he died at 43 years, and Kofi was supposed to live for 65 years. So we are going 65 years from the 65 years. So 20 years. So the years of life lost is 20 years. So with the individual years of life lost, they then add all of them and then try to translate it into economic terms, where we will say that, okay, well, if the person had lived an additional 20 years, the person would have contributed this much to the economy. So it's also a way that people used to measure how mortality costs a country, and also when someone is bedridden or sick. And so, I won't be so if some of you decide to maybe pursue health economics in the near future, you'll be coming across a lot of these things, because it is such indicators that will convince the government whether to spend on certain conditions or not, whether to invest in malaria, whether to invest in cancer, whether to invest in HIV, whether to invest in some other areas. So depending on the burden of the condition. So these are some of the measures for that. And we have self-assessed health status. So the self-assessed health status, today I read an article about how air pollution affects hypertension. And I think the study was made up of 6 different studies, cohort studies from Europe, the whole of Europe. And the people who claimed they were hypertensive, by self-report, they said, "Oman omukanyo," and you said, "Doctor Nekanye." You realize that air pollution increase their risk for hypertension. But strangely, those people who didn't profess, but their BP, their systolic, and all that were measured. We didn't find significant association between that and air pollution, but other studies have seen significant relation. So what I'm trying to say is that a client can come to your facility as a doctor or physician assistant and say that, oh doctor, I feel I am sick, I have malaria. And you may run every test and it may come out as negative, but the person may tell you I'm not well. Sometimes the person may tell you I am well, but you now know that the person is not well. And it's very difficult to convince such a person. So that is the difficulty of community health or public health, because you are working with a community that thinks they are okay, they have everything, but you, the experts, know very well that they are not okay, or they stand a chance of being hit or being affected by a certain condition. So, and of course, and it also shows that, and that particular measure of health is not reliable, because some people will tell you that I'm well or I'm not well, depending on their mood, their feelings. And sometimes even what they are describing to you may not be what you are expecting them to tell you. So it's not a reliable measure of health. So moving on. Any question before I move on with regards to the determinants of health or determinants of health? Any question? Hello?
Yes, I'm okay. Anybody? Any question?
Anybody with a question?
So
can I move on?
I don't think so.
Oh, okay.
Yes.
You guys, the minister we are sharks into you. So now we've seen what health is. We've seen how some measures of health, how health is measured. Daily, in some cases, we have the health quality of life analysis. We have mortality. We've seen all of them. We've seen the determinants of health. So now let's see what development is. Okay, it's anybody who has taken good breakfast or lunch already, who thinks he or she is healthy enough, until proven otherwise, should read. Me too.
Anybody to read? Or Mama Esther, you continue for us.
Yeah, I think Mama Esther wants to continue, right?
Okay.
Okay, what is development?
Yeah, okay.
Development is a process that creates growth, progress, positive change, and improves the standard of living of people within a location.
Yeah.
The purpose of development is to improve the level and quality of life of the population, and the creation or expansion of local income and employment opportunities without damaging the resources of the environment.
Wow. Thank you very much, Esther. Yes, so in a nutshell, development is just movement from an undesirable state to a desirable one. Okay. You are saying that, oh, I'm not happy with, my condition. So I deserve better. And so I'm moving away from where I am now to another place or a stage where I think, I'm okay with or is desirable. So maybe in my community, we don't have toilet facilities. So you have people going to the bush to ease themselves, and some of them come with snake bites. And so as a community, you are not happy and you want to raise toilet facilities in good condition for people to be used. So, and by that too, you realize that as you do that too, you are preventing people from getting snake bites. And by that too, you realize that you are protecting the health of people, especially the working force, because assuming the town carpenter or the town mason is bitten by a snake and a project is up, a community project, and he has snake bite, he's there, or and he cannot work, it's going to affect the progress of the community as a whole. So you realize that one thing leads to the other and continues like that, and so that in the long run, the people enjoy a better life. So going back to the definition, it defines development as a process. So it is not the end though. So that's where I have problem with the so-called developed countries. Okay. They are all moving on. All of their problems are not solved. So they are striving to be better people, but they are calling themselves developed and we develop it, which doesn't make sense too. And looking at the COVID issue, for instance, you realize that they still lack a lot of things. There's this book that I'll share with you called Turning the World Upside Down. They have almost about 95% of the health workers and all the resources, all the money, with fewer population. And we have about 90% of the world's population with less than 10, about 10% of the world's the health workers providing or attending to the needs of this large population. Yet it looks like in most of the cases, we are doing better than them. If you look at mortality, child mortality, maternal mortality, you realize that as they are, with all the resources they have, yes, mortality is coming down for them. In our cases, it's also coming down, but we have the smallest or the small proportion of the resources. So which means that if we should get even half of their resources, we will far outdo them. And look at what is happening with the COVID cases. You realize that the poor countries, including the African countries, have done relatively, in fact, much better than what they are doing with all their resources, the ventilators and all the interventions. They are struggling. Look at the deaths on their hand. So just imagine we have just half of the resources they have and see how things would have been for us. So I don't understand why they call themselves developed nations and we develop it. Okay, so the definition here is it's a process. So no nation on planet Earth can say, so we've gotten there, so there's no need to develop any longer. So it says development is a process that creates growth. So growth, a child is growing. It's not the same as a child is developing. Growth is more like just an increase in size or in number, but development has to do with quality. So if you are growing, you are increasing in age, doesn't mean that yes, you are growing, but it doesn't mean that you have developed, because even a child can behave in a certain way that you see the child to be matured, whereas an adult can behave in a certain way that you doubt whether that person is matured. So it's development is more of quality, not just quantity. So it says development is a process that creates growth, progress. So the progress there, basically, you should have, like I mentioned, you should have something you have said or classified as desirable or that ideal situation, and then you working towards the ideal situation. So the closer you get to the ideal situation, that's what we call progress. So, and yes, and something comes, good comes your way, and you think that you are progressing. No, but once you have that ideal situation and that good thing comes and it is leading you closer to your ideal situation, then you are progressing. And development is another component, is that development comes with a positive change. So in the days of Kufo, when Kufo came and said that, oh, we want change, Ghanaians want change, then the NDC people came asking, so is it possible? So don't listen to Kufo. The change he's talking about, it could be positive change or negative change. So it's not just a matter of yes, the same. So if you are changing from your current state to another state, is it from a desirable state or to an undesirable state, or from an undesirable state to or from desirable state to a more desirable state? Even the desirable component, can say there are levels of, you want a car, but when you get the car, you realize that car no cry, you move cars. Maybe you want Range Rover, you want something, not Picanto, or someone Obikra unya babobo ya cry fine, but later unya obi say unya Rolls Royce car. Yes. So there's always a positive change element and improvement in the standard of living of people within a location. So there's a standard of improvement in the standard of living. Okay, so there's purpose of development is to improve the level and quality of life of people. So you are improving the level and quality of life of people, and the creation or expansion of local income and employment opportunities without damaging the resources of the environment. Yeah, so in as much as we are making efforts to develop, we should make sure that we don't destroy the environment, because you are going to pay back, whether you like it or not. If in the quest of making money in the name of Galamsey, you go around destroying lands, water bodies, forests, or mining, you pay back. And a lot of the conditions, for instance, I mentioned last week, a lot of the conditions we are facing now or infections were acquired, like let's say Ebola, for instance, assuming Ebola and coronavirus were not made in the lab and they are zoonotic infections, like we are made to believe. It basically means that we have trespassed. We are playing with animals that we ought not to have been playing with, or anymore there. So we kill and we chew and we eat any animal, without even preparing them well or cooking them well before eating. You see, once you do that, yeah, nature will also find a way to punish you. You'll be infected with the, but that you cannot survive with. Because there is the HIV one, how do you call yellow fever? They are all from monkeys. But for them, they are fine with those things. Yes.
So I want to ask, so do you mean to say you don't believe it is zoonotic, or so what is your take on it, the coronavirus?
Yes, for me personally, I believe there are zoonotic conditions, and at the same time I also believe in biomedical weapons. So sometimes you can take those pathogens and then work on them to become more virulent, because if you look at the original nature of the coronavirus that we are dealing with, you realize that it was something that was supposed to be in animals only. But it looks like what we are having now was worked on so that it can affect human beings. I don't know if it makes sense.
It does. Yes, it does. Yes, it does.
Yes. So, and of course, so there are biomedical weapons where people can work on existing viruses as weapons, to destroy other people, and they are genuine ones. And even the Ebola has always been with us, but the outbreak we saw in 2014, 2015, further assessment shows that we're trying to engineer it to make it airborne, you see. So people are working on those things, and when sometimes these things leave the labs or they are tried outside, sometimes it breaks out to be an outbreak. Yeah. So it's a stage. I think, is it this semester? Yes. Oh, yes. I think it's this semester where we'll be looking at the epidemiological curve. We are going to see the transitioning of communities and how you know the trend of communicable diseases as against non-communicable, double burden of diseases or triple burden. We look at all those elements and see how people also are creating their own forms of things to create conditions, problems for us. Okay. And the creation of expansion of local unemployment, and yes, without destroying the environment. So we have to be critical. We shouldn't take it lightly with what the Galamsey guys are doing, and even including the mining companies. Sometimes they pour or they discard dangerous chemicals into um, water bodies. That some communities rely, like cyanide. Some communities rely on into water bodies that communities rely on for various reasons, like drinking and cooking and all that, and at the end. And even sometimes because of the kind of chemicals they shoot into the air, when the rain falls, it comes down. People trap them and they become issues. So it is important to develop, but it doesn't mean that when you are developing, you should ignore the fact that the integrity of the environment should be kept. So development is a process rather than an outcome. So yes, once again, it's created that it is a process, not just not just an outcome. So development occurs when natural resources are converted to cultural resources. So that's someone's opinion. So you look around, you use the environment for what you want, be it cultural, for cultural purpose, social purpose, or whatsoever. Okay, and experts are saying
So I
that
have a question.
development, pardon, I heard,
Please,
is
about
that,
the
is that expert?
development
Yeah.
to develop the population. For instance, if
Yes.
you walk through Jamestown,
Yes.
they have public toilet, but some people still
Yes.
go to the sea.
Yes.
So
Yeah.
as a public health, as a community health
Yeah.
personnel,
Yes.
you do all your education and they still go about it. Do you leave them?
Yes. No, you don't leave them. You don't leave them. It's good to educate, but the whites have gone beyond just education to what they call the social engineering. So you can actually, if excuse say our government was that serious about the issue, or an NGO has money and they are interested an alternative way of using the sea. Maybe create a very nice park with very nice fences around, and then empower them to see the place as, let's say, a playing field or a realization point. And you also help them, you also understand how they understand by get the understanding of an ideal place of convenience, toilets, and then try to create it to suit, you know, taking for instance, there was a community in the eastern region that refused to use an ultra modern toilet, all because, well, they were used to using the bush. Two, they realized that even the chief doesn't have that kind of toilet. So it's an insult that the chief doesn't have that kind of toilet and you, the citizens, are using that fresh facility. And three, water was a problem. So later on, they sat with them and then they realized all these things. And then they built a toilet for their chief first. And then they built another one. And that one was actually Shitum, not the flashing one, because they had water issues. So it's about engaging them and letting them know how they want things to turn around and showing them the alternative to things. So wherever they are defecating, the effects of it, and assuming there's an alternative, you also show that option to them. So do they want a community of a very bad scented, with bad scents, and a community that is prone to cholera or other conditions, or do they want a place where their children can freely go and play and all that? So in that case, they will choose between denying their children a very nice playground or relaxation site where people can use as cultural center, people can come and relax and make merry our day and all that, or they keeping to the beach that they sport with their skins, their toilet, excreta, and things that with their little issue, they all fall sick and they'll end up in the hospitals that they cannot even afford medical bills, of which those monies could have been used to do other things. They could have used those monies for other things. So it's about how you go about. So you don't just leave them. You try to explore more and offer them alternatives to what they are doing. Is your question answered?
Yes, sir. Thank you.
Welcome.
Yes, sir.
Welcome. Okay. Welcome. Yes, so we are saying that development is measured by social indicators, economic indicators, and combined indicators. So with the social indicators, those domestic product in yes, so so we have the social indicators, and they include death rates. So the death rate is the number of people who have died over a population by, let's say, if 100% or 1,000, depending on how you want to see it, over a period of time. So when you introduce the time element, it becomes a rate. Okay. So we also have the life expectancy, where we are saying that so the average number of years people in a certain area or geographically defined area are expected, or the mean or average number of years people live in a certain geographical area. And we also have the adult literacy. So how many people in the community or adults in a community are educated? So it is found that as you have more adults being educated, you realize that things around them also improve. Okay, they are, even how they raise the children also improve. The environment, things around them improve, and they are also happier. And we also, another indicator is the calorie of protein per person per day. And we also have population per doctor. We also have infant mortality. So how many children are dying, of a certain age. So I think infant mortality is death occurring before age 5. And even within, we have other forms of mortality. You have neonatal mortality, you have perinatal and all. They are all indicators for development. So if you are in a country and more children are dying, then it means that the country is not safe. It also means that the health systems are not performing well. And it also means that they are more infectious. A lot of the conditions children suffer or die from is infectious conditions. And most of them are from even the facilities, health facilities. Yes, and we have other infections, there's scalar disease and all kind of infections affecting the little ones. So it's an indicator. And you realize that naturally as countries develop, you realize that infectious diseases come down. So with development, so if your infections and children are dying more and more from infectious diseases in particular, then it means that we are not, and population per doctor. So now recently I heard about me saying that Ghana needs a lot of doctors. Meanwhile, there are a lot of people out there who wants to be doctors. You see, and we realize that about 70-80% of all other regions, even you have, hello, internet. Can you hear me?
Yes.
Yes, sir.
Yes, sir.
Yeah, so it's just a matter of government finding money to recruit more doctors. So people love to be doctors, but you cannot hide behind and also complain that there are no doctors. Whereas you are the government, you can choose to spend more resources on training more doctors. The schools are there, people are willing to expand the medical schools, and people are paying fees. So I don't see why governments will be slow, and at the same time coming back to complain that there are fewer doctors. Yeah, and the thing about the social indicators is that much information cannot be obtained from one indicator. So you cannot just use infant mortality to decide whether a country is as advanced or not. Neither can you use death rates, because a lot of things comes into play or influences death. So you cannot just use one indicator or life expectancy to say, okay, well, because life expectancy in Japan is 85, so Japan is more developed than Singapore or Israel. Yeah. Okay, moving on. Indicators do not communicate variations in populations. So yes, so what's one other negative or disadvantage of relying solely on the measures or indicators is the fact that if you look at the data, you realize that the data is aggregated. So when you look at life expectancy like this, just talking about the average age, and the average is when you add all the values for like that, let's say death. So you add all the number of deaths, you add them, and they, like just simple average. Okay. So if Kofi died at age 20, Ama 30, and then Kojo 30, you add the 20, 30, 50, and then 80 divided by the 3. So that's the average, but it doesn't tell you that someone died at age 30 and someone died at a higher age. So it's an aggregation of data, and which is more, it's prone to bias. Yeah. So here we also have economic indicators, which measures the wealth and industrialization of a country. So one thing we've been good at doing is developing for ourselves economic indicators, but the social ones, an indicator, for instance, is the gross national product, which says that the value of all goods produced, services provided in the country, and services and abroad in 1 year. So when you take the year 2020, for instance, so how many, what's the value? So when you take all the value of services and goods produced in a country and abroad in a year. So I think here the gross national product refers to the nationals, so both home and abroad. So how many, what's the value of all the goods produced as well as the services provided? So Ghanaians in abroad, Ghanaians in UK, Togo, Benin, Canada, and Ghanaians here. So what's the value of our goods produced and services provided in the country? Okay. But the GDP here, it refers to what we are producing in the country in a year. So irrespective of your nationality, whether you are Ghanaian, whether you want to help, whether you are Ghanaian or you are a foreigner in Ghana, so we consider all of them. But those are the national products. You're only looking at the effort of Ghanaians in and outside Ghana. Yeah, sure. So moving on, so, over a year, in a 1 year, yes, over a year. Okay, so challenges with indicators, well, does not equate to quality of life and may not always be evenly spread. So when you look at wealth, USA is very rich, but in health, they are doing poorly. So you cannot equate wealth to their quality of life. US is very expensive when you are assessing health service. When you want health service, Medicaid, we have this. It's very, very expensive in US when you go to the hospital, you need care. But it's relatively cheap going to the hospital, or Canada or Britain, where they have they practice a system called Bismarck model of financing care. Is Germany. We have the beverage, that's London. So health there is relatively free, because once you work there, they are going to deduct from your salary. Once you work in UK, or you are in UK buying something or just shopping, they are going to deduct from those means, so that anytime someone is sick, the person can just walk to the facility and then get the service he or she wants at a relatively low cost. Unless you want sophisticated care, that's when you may be allowed to pay so much for healthcare. But in US, with a little thing, you might end up paying, or you might end up giving all your life savings to the hospital. So that one, largely they expect you to use more of national health insurance and all that. So, and by that, a lot of people are sick, but they cannot go to the hospital. And a lot of people have become obese, and they don't see anything wrong with it. And a lot of people are dying in the US from coronavirus. Like we've all come to see that the true cause of coronavirus attributed death is the underlying conditions like diabetes, hypertension, and all have you. And they are so common in US compared to Asian countries, compared to Africa. Meanwhile, these people are very rich. So wealth doesn't necessarily equate quality of life. Yes, you may have all the toys, the nice toys and things, but it doesn't mean you are, your quality of life, it's, yeah. And so far, it looks like the Scandinavian countries like the Denmark, the Sweden, Norway, they have one of the highest quality, they are doing very well in terms of the quality of life. In fact, Denmark is said to be the happiest country on earth. Yes. And another challenge with economic indicators is that indicators are country average. Change in real GDP does not necessarily correspond improvement in welfare. Yes. So in Ghana, for instance, when they are looking at the GDP and things, they are going to look at, let's say, what Kennedy Japan, and despite is doing, including the poor wache seller. In fact, wache seller is Kramo's cow. And they are going to also look at the man by the roadside selling chewing gum. So they are going to add all of them and then say, okay, well, when you look at Ghana's states, it looks like the per capita income is around $4,500. Meanwhile, the person on the streets hasn't even seen $1,000 in his life, but they are saying that the per capita income in Ghana is 4,500. If we should share all our wealth, everybody will be getting $4,500. But the truth is that Kennedy Japan alone has millions of the dollars, and the one on the street has about 10 cedis. So the data is aggregated, so you cannot just rely on the indicators to establish the real or the true quality of life of people. So that is another weakness or shortfall of the indicators we use. They are aggregated. Charlie, let me see how many slides more. Because oh, okay. Where they are indicators, yes, there are gaps. Yes. Okay, so yeah, they are saying they are combined indicators, they have quality of life indicators. Okay, So you see, we mentioned earlier that you cannot use one indicator to measure the quality of life of a group of people. So people have made efforts to find ways to merge some of the indicators. So we have it's saying that we've combined three social factors: life expectancy, infant mortality, and adult literacy, to what we call quality of life indicators. Yes. And we also have the human development index. So the quality of death index indicators are more of health, health workers favor that more, those researchers. And for health, and then those into social development and community, they are more interested in the human development index. So when you want to communicate to WHO, then you want to express more of quality of life indicators like life expectancy, infant mortality, and adult literacy. But if you want to communicate to the UNDP, United Nations Department for Development, and you want to do more of health in the development index, so they also have the indexes. But the good thing is they also look at the life expectancy, they look at school enrollment. They don't only look at adult literacy, and they also look at the GMP per capita and cost of living. So yes, and if with these indicators, when you go to their websites and you are doing research, you can get data on such variables. So this and so according to this, the physical quality of life indicators ranges from 0 to 100. Hence, over 77 is considered good. So the quality of life, you are going to, how do I even go about this? It is scored. So when you add the three life expectancy, so when they are going to score, then you add it to infant mortality and then adult literacy. So there's a scoring system. So the scoring system is between 0 and 100. So when you score the country or the population or the community and they get 77 out of 100 or more, then they are doing well. So anything below 77 is poor. So it means that you have more people dying, you have more infant dying, and there's low adult literacy and low life expectancy. So we also have the health development index, as mentioned earlier, from 0 to 1. So they want to express it in percentages. So 0.8, which is more or less 80%. So anything equal or 80% is good, but anything less than 80, 0.8, it's not good. So there are ways of scoring them, and so using the social, economic, and combined factor, the world can be divided into developed and developing countries. So it is based on these metrics that we've been able to say that, oh, some countries have developed and some others haven't developed. Okay. And when I hear things like this, then my blood begins to boil. Because if you look at the indicators, you realize that there are things that in most cases favors the whites more than us, because here over there you realize that suicide cases are more, but in our part of the world they are less, but you won't hear them talking more about suicide cases. A lot of the measures seems to favor them, so when they are rating, they rate very high. And for them to even classify some as developed and developing regions, I don't understand. We are all developing, only that some appears to be more developed than others. So here they are telling us that there are differences between the developing and developed countries. So the developing countries here are saying that they are relatively low standard of living among population. Their industrial base is underdeveloped and have moderate to low developed index. So the low standard of living, well, most of the cases they look at the per capita income, how much money people will get, if the wealth of the country is divided and all that. And they also look at the schooling, how many people in the country have schooled, literacy rates, and others, as mentioned earlier. And they said industrial base is underdeveloped. Okay, so they are using their industries. But of course, it's good measure, but I also have my own issues. Okay, because every society has ways of meeting its needs. So if we've not built factories as big as Apple and things, Huawei and other companies, it shouldn't, that, that doesn't mean that we do not have our own ways of solving our problem. Maybe our priority is not the mobile phones, but our priority is something else that we have also developed our own systems to meet. So why do you use those industries as standards for determining whether someone has developed or not? Because a place like Dubai like this, apart from the fuel, you don't really see them having a lot of like factories like that. They are trying to develop their tourism sites and things. So there are other things that they should consider rather than just using how many industries you have been able to establish. And we also have how moderate to low human, yes, the index, we've spoken about that. And now they are saying that developed countries, population of developed countries generally have better standards of living. Yes, yes, all because they have more resources to the small number of population they have. Because when you add Africa, India, and China, we carry about 90% of the world's population. And you look at Europe, they have almost, and US, they have too many resources. So of course, they can afford to go to the kind of schools, they can afford to go to space, they can afford quite a number of things, And they said develop industrialization in the tertiary and quaternary sector. Yeah. So yes, so they are far more industrialized than us, and they have high human. So when you use the HDI index or the Human Development Index, you realize that they appear to be doing better than us. But at the same time, I also believe that in as much as we are looking at that, we should also look at the resources that they have available to them. Because if you just look at the outcomes, it's just like the 5 talents stories Jesus spoke about. Okay, so Jesus gave someone 5 talents, and then the person multiplied it, like doubled it, right? 5 talents, and another person was given 2 talents, the person also doubled it. So why would you look at, say that, okay, someone has 10 outcomes and another person has 4, so the person is doing better than, the person with the 10 outcomes did better than the person who has the 4. Meanwhile, the person who has the 4 had 2, and the person who had 5 the person who had 10 had 5. So we are all not playing on an even platform or background. So sometimes personally, I have issues with these indicators, but you should just accept them for academic purpose, okay? But when it comes to debate, then, or when I ask you to discuss them, you can bring in some of these elements, yes. Because education is there to help us think, not just to accept anything that is imposed on us. So some people have come out to say that, well, there are causes or variations in development, okay? And they are saying that, okay, well, trade is an example, population growth is a cause, so industrialization, political turmoil, and physical factors. Yes, it's true. People have raised this argument, but coming from a sociological point of view, when they run the analysis, the key reason some countries have developed and others have not developed is discipline, but it's not mentioned here. It's not really about the population growth. It's not about the industrialization. It's discipline, how we manage our resources, the wastage and all have you. And so setting the pace, I want you to contribute. In your view, how do you think trade accounts for the differences in development in countries? I'm leaving this for you guys to discuss. In fact, I'll give it to you as homework, so let's continue. Let's continue. So someone should kindly read this part. Hello?
Yes, sir.
Yes. Someone should kindly read.
Come on, sir. Please read for us.
Yes.
Okay, don't worry. To come in exams, I'll read and read.
Supervisor.
Can you hear me? My network was misbehaving.
Yes, we can hear you now.
Okay. Impact of
Okay.
Impact of health on development.
Oh, okay.
Human beings are the center of concerns for sustainable development. They are entitled to a healthy and productive life in harmony with nature.
Yeah.
Principle 1 of the Rio Declaration on Environment and Development. An ecologically sustainable development is needed to maintain population health.
Okay, you know what? Do you know what?
No.
Esther.
Yes, sir.
Yeah, you just a declaration. Let's move on. Read here.
Hello.
Yeah. So read from here. That declaration.
Please, can someone take up? I can't even get to my Zoom.
Anybody else? Aju?
Yeah. Nick.
Yes, sir.
Can you read?
Okay, let me see if my network will support. So,
okay.
See the screen. Hello.
Yes, Aju.
Please, I can't see the screen.
You can see the
Screen.
No
screen.
Hey, that's on August. Or call offline.
Only page in the show.
Or call offline.
Take off an bra. Internet is a me put a still. Me Wi-Fi or inside there. Have me put still.
I'm a friend.